Hello. The Senate Drug Price Transparency Bill is a proposed piece of legislation that aims to increase transparency in drug pricing and reduce the cost of prescription drugs for American consumers. The bill, also known as the Prescription Drug Pricing Reduction Act, was initially introduced in July 2019 by a bipartisan group of senators, including Chuck Grassley, Ron Wyden, and Mitt Romney. The Drug Price Transparency Bill includes several provisions designated to promote transparency and reduce drug prices. One of the key provisions of the bill is the requirement for drug manufacturers to disclose the list of prices of their prescription drugs in all direct-to-consumer advertising. This provision aims to promote customers with more information about the cost of their medications, allowing them to make more informed decisions about their healthcare. Another provision of the bill requires pharmacy benefit managers to disclose the rebates they receive from drug manufacturers and the amount of those rebates that are passed on to consumers. Pharmacy benefit managers are intermediaries between drug manufacturers, health insurers, and pharmacies, and they play a significant role in determining the price of prescription drugs. By requiring these pharmacy benefit managers to disclose the rebate arrangements, the bill aims to increase transparency and promote competition in the pharmaceutical market. The Senate Drug Transparency Bill also includes provisions aimed at reducing out-of-pocket costs for Medicare beneficiaries. Specifically, the bill aims to cap the out-of-pocket expenses that seniors pay for prescription drugs and limit the rate of the price increases for drugs covered by Medicare Part D. Right now, I think a lot of Medicare Part D is just like diabetic supplies, like glucometers, test strips, etc. These provisions are designated to protect seniors from high costs of prescription drugs, which can be a significant burden on those with limited income. Excuse me. The Drug Price Transparency Bill has met with both support and opposition. Supporters of the bill argue that it will help address the high cost of prescription drugs in the United States, which is a major concern for many Americans. They believe that increased transparency and competition in the pharmaceutical market will ultimately lead to lower drug prices and better healthcare outcomes. Opponents of the bill, however, argue that it could have unintended consequences. Some argue that requiring drug manufacturers to disclose their list of pricing and advertisement could lead to confusion among consumers that could ultimately lead to higher drug prices. Others argue that the bill could harm innovation in the pharmaceutical company, as drug manufacturers may be less willing to invest in research and develop if they are not able to recoup their costs. So prescription medications are an essential component of modern healthcare, but they can also be very expensive for Americans. The high cost of prescription medications is a complex issue, and many factors contribute to the problem. One of the primary reasons why prescription medications are so expensive is the cost of research and development. Developing a new drug is a complex and expensive process that can take many years and billions of dollars. Pharmaceutical companies invest heavily in research and development, and they must recoup these costs through the sales of their production and, of course, make a profit. This often results in high prices for new drugs, particularly those that are rare, complete, or treat complex conditions. Another factor that contributes to the high cost of prescription medications is the cost of marketing and advertising. Pharmaceutical companies spend billions of dollars each year on direct-to-customer advertising and marketing to healthcare providers. These costs are ultimately passed on to consumers in the form of higher drug prices. In addition to these factors, the structure of the pharmaceutical industry itself can also contribute to high drug pricing. The industry is dominated by a small number of large companies, which have significant pricing power. These companies can set high prices for these products, knowing that their consumers have few alternatives. The role of insurance companies and government program in drug pricing is also important a factor. Insurance companies negotiate prices with pharmaceutical companies on behalf of their members, and these negotiations can be very complex. Similarly, government programs such as Medicare and Medicaid also negotiate drug prices, but the prices they pay are often higher than those paid by other countries. Finally, the issue of drug pricing is further complicated by the lack of transparency in the pharmaceutical industry. It can be difficult for consumers to understand how drug prices are set, and there's often little to none information available about the actual costs of producing and distributing medications. So, in conclusion, the Senate Drug Transparency Bill is a proposed piece of legislation that aims to increase transparency in drug pricing and reduce the costs of prescription drugs for American consumers. While the bill has been met with both support and opposition, its provisions have the potential to significantly impact the pharmaceutical industry and the healthcare landscape in the United States. It remains to be seen whether the bill will ultimately be passed into law, but it is an introduction, like an important step in the right direction, addressing the high costs of prescription drugs in the United States. So once again, another recap. In conclusion, the high cost of prescription medications is a complex issue that is influenced by a range of factors, including the cost of research and development, marketing and advertising expenses, and the structure of the pharmaceutical company, whether because it's dominated by a few huge pharmacy companies, and as well as the role of insurance companies and government programs in drug pricing. While there are no easy solutions to this problem, increasing transparency and promoting competition in the pharmaceutical industry are essential steps towards making prescription medications more affordable for all Americans. Thank you for your time.